Thanks for staying with us on The Real Story. People are weary. It's been a long 2 years with a lot of suffering because of COVID. But we are starting to see what appears to be a light at the end of the tunnel. COVID case numbers are dropping across the country, including here in Connecticut. We are seeing states starting to drop their mask mandates. Governor Lamont said last week he's recommending the state drop its for schools and childcare settings on February 28th. So, are we approaching a reprieve with COVID? Is it too soon to end the mask mandate? We want to talk about it with State Senator Saud Anwar, who is also a pulmonologist, a lung doctor. Remember, COVID is a respiratory disease. He's the one on the front lines in the intensive care unit at Manchester Memorial Hospital, taking care of patients on ventilators. He's been doing it throughout the entire pandemic. Dr. Anwar, thanks again for joining us on The Real Story.
Thank you so much for having me.
Okay, so let's get right to the mask mandate. You were just explaining to me before what action the legislature would have to take. So for right now, the governor has decided that on February 28th, he's recommending the mask mandate end, but his executive orders end February 15th. So it's the legislature that would have to say whether to extend it to the 28th or not, correct?
Correct. So on the 15th, if the legislature does not vote or say no or does not vote on this issue for the mask mandate, automatically on the 15th, that order would expire and the mask mandate would be over. But the question that we have to address is, do we actually have it continue for another 2 weeks or so?
Okay. So, you are a doctor, obviously. Do you think it's too soon for this to happen? We know that respiratory illness season, I'm probably saying that wrong, but it ends generally the beginning of March, mid-March. So is it too soon for the mask mandate to drop in schools? Again, this is not statewide. This is just in schools and childcare settings.
Right. And Jen, the reality is that we are all very tired, just like you said. And in the last 2 years, we have just wished that we can get our lives back together. We can have children able to go to school. We can enjoy our lives the way we used to. So that's what everybody wants. And I can tell you, I also want our children to be able to go to school without their masks and not have to worry about things. But the challenge that we have is we still have some of the cases that are happening. Thankfully, Omicron has not been that bad. But the numbers are decreasing, so it not being that bad and then the numbers decreasing is truly getting us very close to that point, but we have not reached that point. We are about 2-3 weeks away from that point after the 15th. And that's why it's important to just stay the course. We are so close to victory that we can stay there, but we have to, as we get to that point, we also need to recognize with humility that this virus has changed multiple times in the last 2 years. And there's always a risk that it may change into a variant. So we need to remain vigilant while we are getting our lives back, that we need to be prepared that things can change. But before that, we can have a little bit of a breather and then be able to have the children be without masks. But that should be safe in the beginning of March or maybe towards the end of February based on the current numbers.
Okay, so if we're still going in the direction that we're going now, you feel like the February 28th is not a bad way to go for if that mask mandate ends?
Well, the worrying doctor would have preferred the first week of March, but I think we can live till the end of February. But I would urge people to still be careful, make sure if there's no major issues with the children, and if they can stay with the masks for a little while longer, it would be just a little smart and prudent thing to do.
How should schools make the decision? Because what's going to happen is it's going to end on the statewide level, so there's not a mandate from the state, but local school boards could institute, local districts, local municipalities can decide to keep masks in schools if they so choose. So how should schools make that decision?
Jen, that's a very important question, and that's a question on the minds of every Board of Ed member. The principals of the school systems, the superintendents across the state are thinking exactly what you just asked. This is how I would approach this. Number one, we need to make sure that we try to do our best to not make it into a political issue whatsoever, because public health is not political. So that's one thing. The second thing is, I know that there are family members and parents who are very emotional about this issue. I think everybody needs to relax and calm down and start to focus on the science as much as they can. The issues that we have to be worried about are, one, if God forbid there's a new variant, how crazy sick can it get a person? Can it get a person to be critically ill? What is the case fatality rate or the likelihood of killing individuals from the disease? So that's one thing we need to know. Why? Because if there was a Delta variant, and if God forbid a Delta variant like virus comes again, we have to be very cautious. Another question to ask is that, are the current vaccine protecting us? And if they are, that's good news. And then we also, of course, we need to know what percentage of the population that we are looking at is vaccinated. And then, of course, we look at the healthcare system's capacity to manage this, the hospitals, how full they are, what is their capacity. And we put all of those things together. That gives us a glimpse into what we need to do in communities. So I know that right now it's saying that every town makes a decision, but the virus doesn't follow the town lines. The humans do. And the virus can go from one place to the other. And we all know people live in one town, work in another town, they have friends in the third town, and they go out and eat in the fourth town. So we interact with each other. So the communities and regions would have to collaborate with each other. And I'm very hopeful that our Department of Public Health will be providing the guidance, but individuals should start to look at these criteria to make the best decision for the community and the safety of our children and their families.
Dr. Anwar, we just have about a minute left, but tell us what you're seeing on the front lines with patients who are in respiratory distress. I mean, you are with the patients who are, the worst off right now. So what are you seeing? Has it calmed down a little bit?
It thankfully has calmed down, and we are so happy because the entire healthcare system, the people providing care have been so tired and fatigued from this. But I've seen the Alpha variant, I've seen the Delta variant, and also Omicron variant. Omicron has not been as much of an issue in the vaccinated population. The unvaccinated have been getting sick, and the emotional turmoil of the families and the individuals who are unvaccinated in the recent past who were critically ill or going on a ventilator was very painful for them and their families, and it was very late for them to vaccinate it, as many of them asked for the vaccine, but at that time it was too late for them. So, but the disease severity has been decreasing and the number of patients have been decreasing, and that's why the major basic things of protecting yourself, washing your hands, being vaccinated, and wearing a mask, keeping that social distance has worked. It has been effective, and we need to just keep that common sense approach going because it has worked for generations. It is working now, and it will continue to work, and we just need to keep that in our focus in our minds.
All right, so it sounds like everyone, if we could just hold on for another couple of weeks and hope that these trends continue, we can set ourselves up for a more relaxing spring and certainly a more relaxing summer. Of course, the fall, we'll see, obviously, with what happens. We had a little bit of a spike, I think, if I remember, last year. And then, of course, we had the spike before Thanksgiving and then Christmas. So, Dr. Anwar, always appreciate your time. And thank you very much for coming on The Real Story and sharing your expertise, as always.
Thank you so much for having me, Jen.
All right, that does it for us on The Real Story. If you want to watch these segments again, head to fox61.com or download the Fox 61 app and watch The Real Story every Sunday at 10 a.m. right here on Fox 61. Have a great morning.